So Kwam said that this is actually the good slot after lunch because it'll take about 25 minutes for your sugar levels to dive after lunch, so I'm counting on that right now. And really excited to be able to share with you a brief, less than 10-minute presentation to give you a sense of our experiment. It wasn't really an experiment, it was a piece of work that we did collaboratively, cross-sectorally, to support tenants living in social housing. And I think before we get going, I wanted to confess that, like others have talked about, I'm not quite sure, maybe this isn't the time to share this with you, Susan. I don't know that I know what I'm doing. The more, with respect to cross-sector collaboration, because the more we engage in this work, I think the more I realize and we realize that we don't really know what we're doing. It's a bit of a learning process. And I think the same is true for my colleagues at the LHIN, and I think the same is probably true for all of us in this process. So I'm going to get started to tell you a little bit about our work at 291 George Street. And I do know that there are a fair number of people in the room who actually are much more responsible for the success on the ground in that project and could do it justice standing up here. So I'll try and speak on their behalf. This is George. It's a 5-story building, Toronto Community Housing building, home to 132 residents. All 132 units are bachelor apartments, and when we started the project, 88% of the people living in the building were men, middle-aged men, 82% of them 25 to 58, the rest were seniors, and the average annual household income for folks living at George Street was just over $8,000. The building is part of a neighborhood with some pretty tough challenges. I don't know if you know that area of town, but downtown East Side, just to the north, and actually if I go back to the picture, just to the north or the left of your picture are a number of derelict buildings, burnt out buildings, people have been squatting. Just to the north of that is Seton House, the largest men's shelter in North America. And along the street on George, I think the stat is that about 14% of our city's homeless are housed in 3 different shelters along George Street. But what was going on in the building, and the reason we were paying attention to the building, is where our collaborators' interests started to converge, and that's a little bit about what I want to talk to you about today. So from a housing perspective, the vacancies were running at around 15% at a time when in the city, rent-geared income units were the vacancy rate was closer to 1%, so a pretty significant red flag. About half of the people living in the building had concerns around unit conditions, significant numbers of community safety calls to the Toronto Community Housing Unit. Police were concerned because they had responded to what they felt was a fairly large number of violent calls for service, 40 in the 6-month period prior to the project being initiated, and in fact had started to allocate resources to a special intervention at 291 George. From the healthcare perspective, we were paying attention because we were looking at emerged department use and repeat use, and albeit we learned a little bit later in the process that the over 900 repeat emerge visits that we had from that postal code weren't all solely attributed to that one building. We suspected that the population that was moving from the shelter system at Seton House into that building and back and forth, we could guess that the repeats attributed to George Street were pretty high. We were concerned about that. We were concerned about the fact that people told us about unmet mental health, substance use, and other physical health needs in the building. We also knew and were concerned about the fact that the building itself had a pretty bad reputation in the neighborhood, and that was impacting service providers' willingness to go into the building and deliver service. So that meant that a number of people who needed services were not getting them because service providers wouldn't enter the building. It was also a political issue, or was becoming a political issue, because local businesses, the councillor, residents within the neighborhood were really calling on TCH, Toronto Community Housing, to do something about the building. And I had an opportunity to talk with one of the residents who was living in 291 George. I talked with him last week. He was reflecting on what life was like in the building prior to the intervention. And he basically said, like, the building was scary. He was scared to be a tenant in the building. He reflected that the people who lived in, his neighbors who lived in the building with him, didn't talk to one another. They were afraid to talk to one another. People didn't really feel like it was home, or the majority of people didn't feel like it was home. Stairwells were somewhat unusable because people were either using drugs in the stairwells, were sleeping off binges, that kind of thing. The building was pretty filthy, in part because of the vandalism, criminal activity, a lack of respect really for that space in terms of it being home. And try as they may, the superintendent was is the most amazing man, one of the most amazing men that I've met, and the cleaning staff, and they were valiantly trying to keep the building clean, but couldn't. So situations like this are not only a health issue, as we've heard about today, that's the common theme, nor are they only a housing issue. This wasn't just Toronto Community Housing's responsibility, nor was it simply a policing issue for Toronto Police Services to go ahead and deal with the criminal aspect. The driving force behind cross-sector collaboration really is the idea that we can only tackle challenges like this if we shift the paradigm. And I apologize for the hokey kind of graphic on this one, but it was all I could find. But shifting the paradigm of how we work together. So the old paradigm around isolated partnerships, so we're all partnering, but partnerships in isolation, uncoordinated efforts, the siloed funding that we're doing, referrals based on relationships and who we know. We have lots of examples of how that's not working for people. So from the health perspective, if we believe that health is directly influenced by factors outside of our span of control, so things like we've talked about today, safety and security, housing, income and food security, social inclusion, stigma and discrimination, we absolutely have no choice but to partner in new ways to get the results that we're looking for. We can't do it ourselves, and I actually am an advocate that we shouldn't be doing it for ourselves. So the new paradigm is a different kind of collaboration than perhaps the one that we've traditionally embarked on. It's more of a collective action approach to a common goal. So our idea, and forgive me for those who are in the room whose idea in part it was pretty basic. The idea was to bring partners together, bigger than just health services, bigger than just housing. We would really focus on a couple of things. We would address the needs of the vulnerable tenants in the building, provide direct service to those individuals who needed them, but we would also take a community development approach and put in some resources in the building that would support tenant engagement, reduce isolation, and really develop and empower the tenant community. Our hope was that we would put in place a foundation that would sustain the successes long after the project team was no longer specifically in place. And the LHIN's hope was also that we would be able to move those resources, that this would be a transitional and somewhat short-term intervention that we could move to other buildings. Actually, before I move on to that. So as I said, the idea wasn't really novel. It actually came from examples of people around the table who had been working in similar ways, but maybe in more isolated partnerships in different buildings. The difference really was that we made an effort to integrate the efforts. We had an action plan that was a little bit more integrated between all of the partners, and everyone was focused on improving the health and well-being of people in the building. It wasn't perfect, and I would never paint the picture to be that it was perfect, because we are still learning. The partnership really was developed at the system level, between the LHIN and Toronto Community Housing, as well as at the ground level between all the partners who were delivering service and the tenants. The partners around the table included the police, primary care provider, private security company that was contracted by Toronto Community Housing, Toronto Community Housing staff from different departments, community mental health and addiction services that the LHIN had specifically funded to support this intervention, city services like Streets to Homes, and the local city councillor was also involved. So essentially what happened was the small community-based health service team, and that was staffed by HouseLink Community Services and Fred Victor, worked with TCH and other partners to stabilize and build the community. They reached out and supported individuals. So that was their piece of the action plan. Toronto Community Housing and the police worked together with others to improve safety and security in the building, and the councillor provided funding for site improvements. So it was really a collaborative effort to kind of put all the pieces in place. And all of those other partners contributed services as were required. So what happened? Well, the results were pretty amazing. And it didn't feel like it at the beginning. It was a tough slog, as many have alluded to, and I'll talk a little bit more about that in a couple of minutes. But in a very short period of time, the building started to have a significant turnaround, a significant transformation. So the stats that I'm going to share with you today are from the original evaluation, and that was back in 2013, so a couple of years ago. But I visited the building last week to talk to the tenant, James, who shared his story with me. And the project team would also indicate that the gains that we made back a couple of years ago have been sustained. The building really has actually been transformed, and some of you may have seen the article in the Toronto Star maybe 2 or 3 weeks ago, where a reporter went and visited George Street and highlighted it as an example or a model to follow for other TCH buildings. So what happened? Well, people became more stable, their housing became more stable with a large number of early interventions and eviction prevention. And you can see an example of some of the activities that frontline staff engaged in to support tenants with their tenancies, intervened in things like unit condition, behavioral issues, arrears management. Tenants reported feeling safer, and criminal activity really drastically declined. So Toronto Police shared, we had integrated reporting for the first year or so for the project. We had police data, we had housing data, and we had health data. And in the first 6-month reporting period, police were able to see a 40% reduction in violent calls to service. And Toronto Community Housing's Community Safety Unit had a 64% reduction in the same reporting period. So pretty transformational in terms of people being able to live in a safe and secure space. Residents felt supported and engaged and told us about how important the services on site were to them and the relationships that they were able to develop with some of the staff. That translated also into connections to service that those tenants had been marginalized from previously. So about 20% of the residents, or 24 out of the 100 or so that were living there at the time, were referred to primary care who hadn't been attached to primary care previously. 50 were referred to other services, and half of the tenants were actively engaged in meetings and building-based activities, or the community development activities. So the tenant I talked to, James, described the building now to me as his home. He sees it as his home. He's not so sure if he wants to move. He's thinking about maybe getting a bigger place, not a better place. But it's clean, it's welcoming, it's friendly. The stairwells are clean. There are no drug users loitering and taking over people's apartments, and no garbage. These are all sort of his reflections. The gardens, as you see in this picture, are maintained by tenants. And the recreation space is really comfortable. It's got lots of books laying around for people to share, pool table. And the day that I visited James, there were lots of tenants in there just kind of engaging in board games and stuff like that. So a really nice space for people to develop community. So to the point of this little presentation, what did we learn? So the thoughts that I'll share with you are not about the intervention. They're more about what do we learn in terms of cross-sector collaboration. And there was a fair bit of learning, lots of learning, in fact. And it's not that partnerships and collaborations are new, because we know that they aren't. But what might be new in this is recognizing that more effective collaboration requires us to behave differently. So it's not just a matter of doing more of what we've always done. It's looking at the way we're collaborating and the way we're partnering and kind of shifting the way we're engaging with our cross-sectoral partners. We need to bring to the table people who aren't necessarily our natural allies, which is something that I think probably most of us in this room do quite comfortably. But the ones who we don't know very well, perhaps we don't even understand them, we might even disagree with them and their approach, but they all have just as much at stake in the process and the outcomes as we do. So I learned personally that we need to find partners who share our aspirations, because this is really, as Angela said and others have said, this is a tough slog and this is messy work and it can be uncomfortable. And to have some people who share what you're trying to do and your vision and your passion for it makes it easier, more joyful, and more effective. Some people may not know, but when we started at George Street, and I'm pointing over here because Mary's over there, that wasn't a sort of a, oh, let's start at George Street. That was the process that took a couple of years of coffees and lunches and a relationship that was built between the LHIN and Toronto Community Housing, between Laurie and Mary, that led to us wanting to find a way to take a risk, to figure out how we could put something on the ground in a building and make a difference. And eventually we had an opportunity, and others were willing to come along with us, lots of the service providers, the police, and others, to try and make something happen. The next thing I learned was that patience is required to create the conditions for the collaboration. And so I get that earlier we were talking about, okay, enough already, let's kind of move on. What I learned was that because people are coming from different places, they have different goals, aspirations, we need to take the time required to figure out our common language and figure out really what each of our agendas are. Because we all we have a certain lens, we all have things to deliver for our organizations and for our sectors, and until we kind of get some of that stuff on the table, it's really hard to do good partnership work and good collaboration. People and systems need to be flexible. So one of the things that happened was that we got a little bit of funding. It kind of flew under the radar. Again, this is like not good for the CEO to know in the first week of, but anyway. Not really, people weren't really paying attention to this project for the first year or so, which gave us an opportunity to explore without having to deliver with data and outcomes immediately. And that meant we could make mistakes and we could let the process unfold, and that even as it became sort of on the radar at the LHIN was open to kind of looking at other measures of success and not only the ones that would be important to the health sector. So that flexibility is really crucial for both people involved in the process, but also organizations that are sponsoring them. And then the last thing is, and this I think, I look back, we didn't learn it in the moment, but I think we really need to kind of look from a shift from just the problem solving. We went in to fix everyone's problems. We went in to fix the issues, rather than going in to work with people who lived in the building to co-create a vision for how people wanted to live in that building and how they might want to access services and what the community might want to become. And I think that kind of reflection is what's feeding into some of our work as we move forward in other buildings. So it was a huge, for us it was a huge success. I can talk to, when I talked to staff last week when I visited the site and talked to people who were involved at the early days, everyone's really, really proud of what's happened there. The tenants are really proud of what they've been able to do because they own most of what's happening now in terms of carrying on all the activities. We've expanded over the last couple of years into other sites, building on what we've learned. And as we move into other sites, the three questions that I kind of keep asking myself and kind of putting to the LHIN, I guess, and I would put them to you too, is really, are we ready to support and provide a new kind of system leadership where we're not always driving the change, but we're actually facilitating some space where we can collaborate together? We don't always have to own, and it always doesn't have to deliver directly and immediately on the things that we have to deliver on. And are we willing to actually, as organizations, develop skills and culture to support the shift that needs to happen in order to support cross-sector collaboration? And lastly, I will leave you with a short quote that I discovered when I was reading an article last week, kind of doing some thinking about some of our work. The wicked leader is he whom the people despise, the good leader is he whom the people revere, and the great leader is he of whom the people say, we did it ourselves. And that's certainly how I feel what happened from the team's leadership at the George Street site.
Excellent. Thank you very much, Laurie. I'm going to turn very quickly to you for 2 questions from the floor that you'd like to ask. I think many people reading the Toronto Star were immensely cheered to read about the success that you've enjoyed with these collaborators on George Street. Are there any questions for Laurie? Jenny, we'll come to you, and in fact, I'm going to come to you. How about that?
Thanks, Laurie. Thanks for the presentation. It's a very encouraging and compelling story for all of us to hear. I was struck by the ability of this project to have sustained results, and I'm wondering what the factors, from your point of view, are to contribute to the fact that the building has stayed in this pristine condition, and the vision is actually, you know, we've seen it over, how long has it been? A year? 2 years?
It's 3.
3 years now. So what do you attribute those sustained results to?
Well, that's actually one of the evaluation questions, I think, that we have an evaluation happening right now to figure that out. How long do we need to stay as a project team in buildings, or what's the recipe for success in terms of the right amount of service versus empowerment of the community that's living in the building, and what does the infrastructure look like? But I would say that it looks to me from the outside that the tenant community is really driving what's taking place at that building. So the staff team that was there supporting the project must have done a number of good things, the right things, to develop the community, who then took ownership over it. We didn't ever move out of the building entirely, so there is a staff member there, currently staffed by Fred Victor, who's staying in, providing, you know, support and attaching people to service. I think he's there a couple of days a week now. So tenants also know that they haven't been abandoned yet again, that there is support still in the building. And that notion of, once it became the way people wanted it to be, they didn't want it to change back. So I think people have made a lot of effort to kind of keep it moving forward. Other than that, I don't know.
All right, over to the far corner there.
Hi, it's Brian Davis, who's quite involved in this project. And one of the things that I was thinking about this morning, and I think it was what's the word, illustrated in the George Street project, is when we talk about health equity, it's not just about, when we look at shifting funding, it's about the Maslow's hierarchy of needs. And it's, you know, when we see an individual who is dealing with bed bugs, and they, you know, the stigma attached to bed bugs and not being able to access other, like going to doctor's appointments, or not having the tokens. One of the things that we did at the George Street project was involve tenants and a landscape crew in order to beautify the building, because it was really important for them from a pride perspective to address the stigma. So I'm just thinking that this afternoon, where we're talking about how do we look at health equity, you know, we need to think about Maslow's hierarchy of needs, and really make sure we're cognizant of what's necessary, what really is important to the people that we're serving, so it has a big impact on their other parts of their lives. Thanks.
I think that's a really good point, and it relates to the point I made earlier about having some space to not have to track and produce specific kind of outcome measures right away, because what we did see really quickly was, you know, improvement around a whole bunch of other things that were important to people, but we couldn't see the health results. We're still having trouble actually tracking how we'll look at some of that. So, you know, being able to operate in that way was really important.
All right, I'm afraid we're going to have to hold things there. Thank you once again, Laurier.